Well, you don't need to be a Trump partisan to feel good about the president's recovery. You just need to be a decent person. The moment you find yourself rooting for another man's illness or death is the moment you need to stop immediately in your tracks, pause, and take stock of your soul. You're the one who's sick and badly in need of help. You're rotting from within. But the media are not stopping. They're not even pausing. They're too angry. Donald Trump is alive. They were hoping that wouldn't happen. Worse, Trump walked out of the hospital under his own steam after just 3 days. 74 years old, and the virus didn't really slow him down. In fact, he looks fine. These are dangerous facts. If you're allowed to think about them too much, you might draw the wrong conclusions. You might conclude the coronavirus isn't quite as scary as they're telling you it is. You might regret giving up your constitutional rights in a panic last spring, or letting them destroy the American economy in response. You might find yourself enraged that they're keeping your kids from getting an education and have for 6 months. And above all, you might stop believing the news media. Why are we watching this crap? It's not news. It's propaganda. They're lying to us. We just caught them again. According to the CDC, 99.98% of coronavirus patients under the age of 49 survive. Even old people get over the virus, almost all of them. According to the CDC, the survival rate for people over 70 years old is 94.6%. That's all people over 70, including people who are 103. Together, it's 95%. Ordinary shingles may be more deadly. It turns out, quote, 90 times more likely to die isn't actually a death sentence. Understatement. But the median age of death for coronavirus in this country is 78 years old. As it happens, 78 is also the life expectancy for all people in this country. In other words, it's dangerous to be an old person who has the coronavirus. It's also dangerous to be an old person, period. At some point, we're all going to die. Dying is the central fact of life. Unfortunately, a secular society has no answer for that, no explanation, and no comfort to give us in the face of it. So no wonder we're so terrified. But what if we were less afraid? What if the news media weren't frothy in a partisan frenzy a month before an election? What if we could think clearly? What kind of conversation would we be having then? We might have some very tough questions for our public health authorities. Donald Trump lives in one of the safest, most controlled environments on planet Earth. If you're looking to stay free from disease, you would try to move to the White House. Everyone around the president is tested regularly. There are doctors everywhere. Donald Trump got the virus anyway. So they're telling us that Trump got infected because he ignored coronavirus protocol. That's a lie. Lots of people follow the rules and get the virus anyway. It may have happened to you. You probably know someone it happened to. Our rules don't work very well. That's the real lesson here. Our rules don't work very well. So we're destroying our society and we're still getting sick. There has to be a better way to do this. And in fact, there is a better way. Sweden is a rational country, unlike us. The Swedish government never forced the entire population to wear masks. Sweden didn't shut down its entire economy. So what happened to Sweden in the end? Well, Sweden has a population of more than 10 million people, and yet the country averages barely more than 200 new coronavirus cases a day. That's been true for the past several weeks, all through the month of September. That's far better than, say, Spain, which has around 10,000 new cases a day, or France, which is reporting about 12,000 new cases a day. Last month, only a little over 1% of the coronavirus tests administered in Sweden came back positive. Compare that to 7% in the northwest part of England. Sweden's per capita rate of new cases is lower than neighboring Denmark or the Netherlands. Here's what Sweden looks like now.
It looks like the world we lost. Cafes and restaurants full, people relaxed, no face masks, no panic. Sweden kept most of its schools and businesses open. It asked people to socially distance. Half of Swedes live alone anyway. It banned large gatherings, but imposed few other rules.
As for Sweden's buses and trains, well, take a look at this.
Not a face mask in sight. Sweden's biggest hospital, the intensive care unit, overwhelmed in the spring, is deserted.
It looks like the world we lost. Ah, what a poignant observation that is. Poignant because it's true. The Swedes unlike our health authorities, followed the science, and it worked. Meanwhile, and CNN will tell you this at least once an hour, we've had more than 7 million positive results on coronavirus tests in this country. We've had 209,000 deaths. Those are the numbers you'll see on the screen. But even now, we still don't know what they mean because there's so little transparency. For example, what exactly counts as an official coronavirus death? We wish we could tell you. We know from CDC data that as of last month, the total of almost 6,500 coronavirus deaths list, quote, intentional and unintentional injury, poisoning, and other adverse events as comorbidities. So if people are poisoning themselves or falling off of ladders or dying in car accidents, why are we counting these deaths as coronavirus deaths? That's unclear. We should know, but we don't. We do know that some physicians have said they felt pressure to classify deaths as COVID-related, even though they clearly weren't. In Bakersfield, California this summer, two physicians, Dan Erickson and Arun Masai, said that exact thing in a YouTube video. They're clinical physicians. They treat the coronavirus. And they told us their experiences doing that. But YouTube scrubbed the tape. Suddenly, we're not into details in this country. The big picture is good enough for us because the big picture supports the strategy our leaders support. They think it's working. In New York City, Bill de Blasio announced today he's closing schools and businesses in 20 neighborhoods in Brooklyn and Queens. This is absolutely necessary, Bill de Blasio says, even though, of course, it greatly pains him.